Hello, hello again. My name is Jody Scholes. I am your instructor for the MBLEX review course. I am delighted to be here today. I just so enjoy grabbing you by the hand and by both hands and being, let's go. Let's learn some stuff. Let's do this thing. Let's do this thing called Get Ready for the MBLEX. Quick housekeeping in that if you're with me live, if you could just mute your microphones on your computer or on your phone. As people jump in, they may have their microphone on, so there might be a minute of distraction, but best practices is to keep that microphone off. Feel free to turn your video on, turn it off, whichever you prefer. I'm good with either. But also one other piece of housekeeping is, here is the chat. Most of you know where is the chat. And so, oh, hey, Muriel, driving. Okay, good. That's all right. That's good. And so when I'm asking you your questions later in our class, if you have a question or you have a response, then go ahead and stick it in the chat. And you can start practicing even now, with answering questions, because that's going to be part of our class today. So what is our class today? Our class today is on anatomy and physiology. So many of you have said that this is an area that challenges you. So we're going to go through some anatomy and physiology today. And then we are going to go into dissecting some questions. So just to give you the lay of the land, we're going to do a quick overview on the MBLEX itself. Then the bulk of our class is the foundational learning. So going back to those basics, going back to the anatomy and physiology, refreshing your memory on some of those big muscles that we definitely need to know. And then we're going to move in to reviewing some specific test questions that have to do with anatomy and physiology. So let's jump right in. The very first thing I want to talk about, and for me, the theme of what I wanted to talk to you about today was release. The word release. And as you come to this class, wherever you are, whatever you're doing, I would like you to take this opportunity to release what has come before today, what has become before this minute. So just, you're here now. There's crazy, hectic times. You cannot make up the craziness. I mean, if I was to ask you what's been crazy this week, you guys would have a length this long in the chat box, for real. I mean, we're being recorded, but I will tell you, I literally had a client ask me to give him a shot of testosterone in his butt. Just brought it with him, thought it would be fine. You know, could you just stick this in my butt? Honestly, there are so many crazy things that happen. And so I invite you now to just release that. I'm inviting myself also to just release that, to let it go, and to be present right here, knowing that you are bringing your highest self to this class, and that this is where your highest self shows up. This is where we come together and we dream a little dream. And that little dream is that you are a licensed massage therapist. I already see you as a licensed massage therapist. This isn't a stretch for me. This is who you really are. And so when we connect our head with our heart, when we imagine, we think a thought, and I believe thoughts are things. So we think a thought, And then we have a feeling about it. And again, this is about releasing, right? Releasing the bull crap. Okay? The stuff that other people say, that other people raise an eyebrow, out, goodbye, gone, present moment awareness. In this present moment, all is well. And in this present moment, we get to think, as a licensed massage therapist, how often will I work? Will I work full-time or part-time? Will I see private clients or will I work in a clinic? Will I work at a wellness center? Will I work at a chiropractor's office? What am I going to be paid? Am I going to be paid? Am I going to charge $100 an hour and I'm going to go to people's homes or have my own space? Yeah, exactly. Am I going to go to work for someone else and get paid $30 an hour, $40 an hour? What does that look like in my work? What does it feel like when I have paying clients on my schedule? What does it feel like to have money in the bank, to have money in savings, to have extra money from doing massage therapy? See, I already see you there. I already see you there. And when we connect our head with our heart and we have a feeling, that feeling is the zhuzh. That feeling is the energy. That feeling is the vibration of what brings that dream, that vision, that affirmation, that truth into the here and now. And so part of passing this test is knowing, is coming back to the feeling of knowing. You're a licensed massage therapist. It's just not on paper yet. You're a licensed massage therapist. It's just not on paper yet. Yeah. All right. Time to learn. You know, my nephew, when he was in school, well, he went to first grade. And I said to him, Will, what'd you think of first grade? And he said, Aunt Jody, it's just learn, learn, learn. Learn, learn, learn. So, well, you know what? It's time to learn, learn, learn. All right, and today we're going to learn about anatomy and physiology. Yipper, how fun. Now, I'm going to go into a level of detail that we're going to cover the leg and the foot. We're going to cover the upper leg, the pelvis. We're going to be going through some different things. It says leg and foot, but to be honest, we don't need to know the little muscles. 680 muscles, by the way, in the body. 206 bones. Yeah, you don't need to know them all. You need to know the big ones. You need to know the ones that are most positively affected by massage therapy, most commonly injured, most affected by pathology or disease. But we do need to know some anatomy and where these things are. All right, let's go through. So this is a closer look at the lower leg. Here we are, and we're going to talk about the Popliteal Fossa. Fancy way of saying the back of the knee. But on your test, it will be called the Popliteal Fossa. The reason that we talk about this, there we go. We talk about this right here, the back of the knee. We're not talking about the sides of the knee here. All right, we're talking about this soft part in the middle. And the reason that we talk about it is because it's considered an endangerment site. It's actually considered a place we don't massage. So an area of caution. So that doesn't mean we avoid the knee. So the patella, right here, the kneecap, lovely to work all around that kneecap. So nice. So nice when we're doing posterior leg to work the sides of the knee. Attachments from the hamstring come right on down here. Whoop, whoop, hamstring, those three muscles in the back of the leg, the back of the upper leg. And those hamstring attachments come right down here, cross the knee, and attach right in there. So lovely to work that area, but the back of the knee is considered an endangerment site. A little ahead of myself here. All right, patella. All right, we know kneecap. Another way to say the kneecap is the patella. What's another way to say the collarbone? What's the anatomical name of the collarbone? If you're driving, don't type. But if you're safe and in front of a computer screen with a keyboard or a phone, feel free to type. Question is, what is the anatomical name for the collarbone? Boom, 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 boom. Yes, exactly. Yes. So the collarbone is also called the clavicle, right? What about the shoulder blade? What's the anatomical name of the shoulder blade? Boom, boom. Let's see. Boom, boom. Yes, scapula. Very good. Very good. Funny thing is, we need to know all the anatomical terms for the test. And then they say, don't use them with clients. Don't use them with clients because it's jargon and they may not understand. All right, tibial tuberosity. So this is the top of the long bone in your lower leg called the tibia. And right at the top of the tibia is a little bony landmark called the tibial tuberosity. And that's what tuberosity means. It just means it's a bony landmark. There's another, yeah, I know, right? That's the hardest part. Don't use the jargon, but use it for the test. Tuberosity simply means a bony landmark. Who can tell me the common name for the ischial tuberosity? Ischial tuberosity. Where is it? Where is it? Where is it? Where is it? All right. Yes, very good, very good. I'm going to let other people have a chance to think about that if they didn't see the answer in the chat. But Lynn got it. All right. As we come down, we see this attachment site for the pes ascerinus. You don't really need to know much more than that, that there's just an attachment site here. Back of the leg, gastroc, gastrocnemion, gastrocnemius, sorry, my pronunciation. And that's the heart-shaped muscle in the back of your, on the back of your lower leg. And there are two muscle heads to the gastroc. That's the short way we say it, right? The common name being the calf, but the calf is also made up of another muscle that's below the gastrocnemius, and that's the soleus. We'll see that in just a few minutes. Yes, exactly. Underneath is the soleus. But that nice heart-shaped muscle with the two heads, that one right there, that's the gastroc. As we look over here, there's a lovely set of muscles on the outside of the leg. And if you haven't spent any time massaging those, whoo, take some time. Go ahead. See if you can do a little gliding, a little heel friction, even a little petrissage using your thumbs. You might consider that friction. I consider it petrissage. But to warm up the outside of the lower leg. That's where the tibialis anterior lives. This is also, and that's all you need to know. We can talk about the movement of it. It everts the foot, but we'll talk about that later. But just know that there's a nice group of muscles out here with the tibialis anterior and your peroneals that help to stabilize your lower leg. And guess what? The weight of our entire body goes through the lower leg and foot. And we hardly spend any time massaging them. Maybe you massage feet. I'll bet you massage feet. But let's not forget that lower leg. It feels really good. In fact, the next time you get a massage, ask for some specific work on the lower leg. Be interesting to see if they can actually do it. All right, shaft of the tibia. That is just the long part of the bone, the shaft of the tibia. That's the longest bone in your lower leg. What is the bone of the upper leg? What is the long bone of the upper leg? Oh, we got some people on that. Oof, Lynn's on fire today. She came to play. She came to play. All right, I like it. Answers are going in that chat box. What's the long bone of the upper leg? You definitely will need to know this. Okay, good. Thank you. Yes, it's the femur. That's correct, the femur. Thank you. Moving to the opposite side here, you'll see the calcaneal tendon. So the calcaneal tendon has a common name. It is named after a Greek god. What is the name, the common name of this part of the body? It's abbreviated. We don't ever abbreviate it, but the initials. The initials are A and T. Anatomically, it's called the calcaneal tendon because it's a tendon and it attaches to the calcaneus. The calcaneus is our heel bone. We'll see pictures of this. We're just going over the general regions right now. We'll see pictures of it in just a minute. So the calcaneus is also the heel bone. Here is the lateral malleolus and the medial malleolus. Go ahead, and if you're in a safe place, go ahead and touch your medial malleolus. Medial malleolus, it's on the inside. It's the ankle bone on the inside. Medial, inside. Lateral, outside, right? More lateral. So the lateral malleolus. If you're touching your medial, you can probably reach your lateral. Go ahead and touch your lateral malleolus. Yes. All right. These are some extensor muscles, tendons and extensor muscles in your foot. But let's go ahead. Don't really need to know it, but just I'll mention that this is the tendon of the anterior, the tibialis anterior, simply to remind you that muscles are attached to bones with tendons. So bones are attached to bones with ligaments. So muscles are attached to bones with tendons. And bones are attached to bones with ligaments. I might have too many things open on my computer. That's all right. Sorry my video went out, but let's see if we can get it back. All right, we'll see. Yeah, okay. All right, and so I asked a question, what is this calcaneal tendon? And did I see any chats come in? I did not. It is also called the Achilles tendon. Have you heard of that? The Achilles tendon? Yeah, exactly. Achilles is a Greek god, and he got an injury to his Achilles tendon, to his tendon here. And that's why the common name of this is the Achilles tendon. And that's normally what it's called in test taking as well. So, so this Achilles tendon is attaching a muscle to a bone. Tendons attach muscles to bones. And so it is attaching the soleus, this long, thin muscle, skinny, cylindrical, that goes under the gastroc, right in here, the soleus. It's attaching that muscle to the bone, the heel bone, or the calcaneus. Let's get to it. Let's go see some bones. All right. We're going to see bones and muscles in just a moment. Anatomical things of the foot, the ball of the foot, the arch of the foot, the heel of the foot. So the ball of the foot, the arch. We actually have two arches. We have a longitudinal arch. So that's the arch we all think about, right? The one that we can just touch and feel. It's right here. But we also have an arch of our foot that makes like a bridge, and that's called the Latitude Arch, but we hardly ever think about that unless you take further continuing ed. The arch we're normally referring to as the common arch right here, but there's two, one that is on the instep of your foot, and then one that goes over your foot. Those are two different arches. And then the heel. Yep, the calcaneus is the heel. And the bones of the foot are called the metatarsals. And we're going to also see the tarsals. So we'll take a look at those in a minute. And when you see stuff like this, tendons of the extensor digitorum longus, all you need to know is that's the foot. You actually don't need to remember like old, like what are the names, you know, and the origins and insertion of these muscles of the foot. No, just to know that digitorum longus, hallucis is another name for the big toe. So those are indicators we're talking about the feet, which is why we're going over them again. All right, so this is an exploration in myofascial work around the feet. Myofascial work is MFR, myofascial release, works with the fascia, and the fascia surrounds all of our muscles, all of our organs, and surrounds us. Who's familiar with fascia? Did you learn? Just put yep in the chat if you've heard of fascia. At this point, I'd imagine you have, just maybe don't exactly know where it is. It is the layer. Yeah, I'm seeing a lot of, let's see. Yep. Excellent. I'm seeing a lot of yeps coming in. Good. So it's the layer between the lowest layer of skin. In fact, the best way to describe it, have you guys ever bought a whole chicken and then you've kind of broken it apart to cook it? When you peel back the skin of a chicken, you know, if you're taking the skin off of the chicken, there's this kind of clear, slippery layer. Yes, under the skin. Yep, exactly. So it's under the skin, but there's this slippery layer that you can see, right? Kind of lets you pull the skin off. That's actually the fascia. Yeah. Now, when you see gristle, you know, when you get a chicken and you pull that skin back, and sometimes you see that little white stuff, and it's like, ooh, this must have been an active chicken because there's all sorts of gristle. Gristle is a way that the fascia is adhering to the muscle. So it's actually like almost like not attachments, trigger points or sticky parts. So when you see that gristle, now on a chicken, we got to cut the gristle off, right? But on a person, the good news is when we warm up the fascia, it actually gets slippery again. It gets clear and it moves. And so you can see here some examples of doing fascial, let me move us out of the way, fascial release work on the Achilles tendon, on the front of the leg, and on the top of the foot. It's lovely to explore. All right. A couple pathologies of the knees, Patella femoral syndrome. It's a pathology, a condition where there is degeneration of the cartilage that's under the patella. So when you hear patella femoral syndrome, the femur is involved, the patella is involved, and it's a degeneration. So here again, anatomically speaking, this is the tibiofemoral joint. Tibia, this long bone, right? Femoral, femur. So where that comes together, it's the knee, but it's the tibiofemoral joint. So there's a structure under the patella called the patella ligament. And this is an area also of concern when treating this pathology. So we've talked about the big long bone of the lower leg. There's also a little bone. There's two bones in the lower leg, the tibia and the fibula. And the fibula, a fib is a little lie. The fibula is the little bone in the leg. So it's still long, it's still a long bone, but it's smaller. It's the kind of a little bit in the back. The tibia is your shin bone. The fibula supports the lower leg structure. We're going to just take a look here too at the Talocruel joint, which is basically, again, a fancy way to say where the ankle bone is. There's a nice divot in the front of the foot. And so the front of the foot, the front of the ankle. I said that improperly, sorry. The front of the ankle. Right where the tibia ends and the foot begins. There's a nice little divot in there, and it is a super highway of different ligaments and tendons. That talocruel joint, so talo being the talus, this is right in the very, very front of the ankle. Lovely place to do some massage and body work. I mentioned the bones of the foot. So let's see how we're doing on time. Excelente. All right, so the tarsals, okay, let's start with the calcaneus. That's the heel bone. The talus is the one we can feel from the front of the ankle. We've got a few other bones of the foot, the cuboid, the navicular, the cuneiforms, but really these are all called the tarsals, right? So the metatarsals, tarsals. So to me, for some reason, that feels like talons. And we only have tarsals in the foot. Metatarsals are the middle bones, and the phalanges are the toes. Phalanges can also be fingers. Yeah. Good to know that the pathology of the foot, and we've seen this question more than once on the MBLEX. One of the pathologies of the foot is pes planus. Pes planus, like a little Pez dispenser, right? Pes planus, it's simply flat feet. So if they're asking you a question about the pathology of pes planus, it has nothing to do with the upper body. It has everything to do with the foot. It is a flat foot. Another pathology is plantar fasciitis. Plantar fasciitis affects, let me move us over here so you can see. Plantar fasciitis affects the plantar fascia. I believe I have a picture of this in just a moment, but may sound familiar to you. It's the bottom of the foot. Client will report when they wake up in the morning and they go to take that first step out of bed, that it feels like they're going to pull something in the bottom of their foot. That is their plantar fascia. Their plantar fascia is tight. Plantar fasciitis, again, we talked about itis being inflammation, arthritis, bursitis, osteoporosis, itis, inflammation. Porosis isn't actually itis, but arthritis, better example. Arthritis, bursitis, appendicitis. You have appendicitis, your appendix is inflamed. All right, so plantar fasciitis is inflammation of the plantar fascia. All right. We know where the patella is located. Good to know, though. It's the largest sesamoid bone in the body. There are different types of bones. We have long bones, but we also have a sesamoid bone, and that is what the kneecap is. Sesamoid bone is simply a bone embedded into a tendon. So it's actually not attached to the body, technically, other than through tendons. All right. When you listen here, just before we leave this, when you listen to the lower body instruction in the online learning center, you will have the opportunity with lower body, anatomy and physiology, lower body, to watch a video that is the Valgus test and the Varus test of a knee. This is one of the tests that PTs use to determine injury. Valgus tests the medial collateral ligament. The Varus tests the lateral collateral ligament. But Suffice to say, if those are new words for you, just watch the video and you'll see a little bit more about that. Unlikely you'll be tested on it. It's actually out of the scope of our practice to perform that test, but it is something that is in our world for other licensed healthcare professionals to be diagnosing. And it's a good reminder that we don't diagnose or prescribe. Yeah. Yes, valgus is the knock-kneed. Yeah. There's weakness in the medial area. Thank you, Lynn. All right, let's move along. It's worth mentioning these are images used with permission from Trail Guides to the Body. Plug for Trail Guides to the Body. They do a lovely job in giving us our anatomy and physiology. Thank you so much, Trail Guide to the Body, for letting me use these pictures. Okay, so here we see bony landmarks of the leg and knee. Here's the femur, here's the patella, here's the tibia. You can see a little image on that tibial tuberosity. Medial epicondyle, again, a little bit more detail than we need to get in this class. I mentioned that this is a video you can watch in the interest of time. We're going to move through that video because you'll probably want to watch it more than once. It can be a little bit confusing as to what they're testing. The point in me mentioning it to you today is so that you're familiar with the words. The valgus stress test and the Varus stress test. If you get a question on the MBLEX that asks you or that tells you your client failed the valgus stress test, there's going to be damage to the medial ligaments. If they failed the varus, it's the lateral ligaments. So medial versus lateral. And you can watch that a few times. All right, let's look at plantar flexion. And we're going to just touch base on what moves the leg. So a good reminder that we have no pump to move blood in our lower legs. So we have no pump, like we have our heart to pump out the blood, but we have no pump that pumps back. So we pump it out into the body. And the only thing that brings our blood back to the heart is muscular contraction, especially in the legs, because gravity is playing a part there, right? We can lift our arms up and we can, kind of help that blood move back down our arms. But with our legs, we can put legs up the wall. If you've ever done that in yoga or just as a hip rebalancing, it's a lovely posture for insomnia. Legs up the wall. So you scoot your butt right against scoot your hip against the wall and then turn towards the wall and put your legs up and lean back. So you're laying on the floor on your back or on your mat, on your yoga mat, but your legs are up the wall. And just imagine how gravity is now working to pull that blood right back down the legs. Lovely, lovely, lovely for many different conditions. Plantar flexion, we've got these muscles involved, the gastroc, the soleus. Those are the major antagonists there. So plantar flexion is going up on your toes. You're flexing that bottom of the foot. You're moving that bottom of the foot muscle in plantar flexion. You're pushing down on the gas pedal. That's another way to look at plantar flexion. That's where we've seen it before, right? In our classes, pushing down on the gas pedal. All right, yeah. So it's also going up on your toes. Yeah. All right, dorsiflexion. We covered this a couple weeks ago. Dorsiflexion, remember that dorsal fin of a dolphin? So that fin on the dolphin is called the dorsal fin. And imagine that's you have a dorsal fin on the top of your foot. That's dorsiflexion. You're bringing it up, bringing it back towards you. And the movers of the dorsal and movement is happening at the Talocruel Joint, right back here, right in front. There's movement happening there. Tibialis Anterior, we talked about that, yummy muscle. Dorsiflexion, that's the major mover. Your Tibialis Anterior. Yeah, those little extensor muscles in your feet actually help too. However, major mover, tibialis anterior. Part of the reason it feels so good to massage it, in my opinion. All right, is that enough for one session? Oh, it might be. We got a couple more minutes before we move into questions. So let's just take another look at the anatomy. We'll go a little deeper dive. We've talked about the anatomy of the foot. Metatarsals. These are the tarsals. Metatarsals, phalanges. Yes. This is the arch of the foot. And you do not need to know, again, I'm showing you this more so to tell you what you don't need to know. But again, this is the transverse arch. So it's not really showing you the transverse arch. The transverse plane, if we go back to our directions, it actually is about right at our belly button. And it separates transverse, right? Like, to me, that when I think of transverse, I just think of this long kind of desert plain. I don't know why that image comes to mind, but the transverse plane cuts us in half in the middle. So the transverse arch cuts our foot in half. So we've got the longitudinal arch, which is the familiar one, and then the transverse arch is the bridge we've talked about before. All right, let's move along. Lateral medial malleolus. All right, these are bony landmarks of the foot, the calcaneus. It's worth it to mention some reflexology here. Probably won't get any questions on reflexology, but we do have questions when it comes to these areas of the foot. And we're touching both the medial and lateral bony landmarks of the calcaneus. And why is that important? Why are those areas important in reflexology? Do you remember that from school? Did they talk to you about reflexology? See, reflexology is the study of the nerve endings of the bottoms of the foot. How many are familiar with the term reflexology? Yeah, so that is something your instructors probably mentioned to you, but the lateral and medial parts of the calcaneus are reflex points for reproductive organs. Good, I'm seeing a lot of yeses coming through the chat that you've seen this before. Awesome. So I want to remind you that there are some schools of thought that say that it is contraindicated to work the medial and lateral calcaneus in the first 3 months of pregnancy, because these are reflex points for reproductive organs. It is a possibility, albeit rare, that by working those areas, it can relax the uterus. So this is something that for thousands of years has been taught in reflexology to promote fertility, because by relaxing the reproductive organs, a woman can release an egg, or maybe even 2 eggs, depends on their cycle. But it's more likely that a woman will release an egg when those reproductive organs are in what's called homeostasis. They're in their homeostasis. What is homeostasis? How would you describe that? Have you heard that word before, homeostasis? It's like balance in the body. It's the way that that organ was meant to work, not stressed, not hyper, not hypo, but homeostasis, happy place, balance. And so by working those areas, the medial and lateral areas of the calcaneus, of the heel bone, those are reflex points to create homeostasis for men and for women. It's a reflex point for men and for women. We both have reproductive organs, but its focus is on first trimester of pregnancy. Just avoid the area. It's a local contraindication for the first 3 months of pregnancy. Very, very, very low percentage chance that there would be any challenges. However, if the client doesn't know it's a high-risk pregnancy, just best to avoid the area. And so again, that would be considered an endangerment site or an area of caution. These are things that are on the MBLEX: endangerment sites, areas of caution, special populations. We got it all in a pregnant woman. We got it all in a guy with ED. Oh, yet another funny story. Yeah, I did it. Client, first-time client. I'm looking down. Anything else you want to mention in your health intake, right? Yeah. And on the other, it says ED. And I'm like, hey, what's ED? And the client doesn't miss a beat. Erectile dysfunction. Oh, whoops. Good for me. I have to say I felt something. I felt a little embarrassed. I felt like I had stumbled into private business. Because what in the world could a massage do for ED, right? We don't massage that part. Well, guess what it does for the condition, for the pathology of erectile dysfunction? It improves circulation. We're not massaging the penis, the testes, we're not massaging any reproductive organs, but when we improve circulation overall, we improve circulation overall. That's a good thing. And clients have reported that things are working better as their homeostasis is found within their body. But specifically, and this is just between you and me, right? We're not going to tell our clients this next part. But when we work the medial and lateral areas of the calcaneus, that heel bone, we can actually improve the nervous system in their reproductive organs. Now, how do you improve the nervous system? Well, the nervous system runs on synapse, right? And we can improve the communication between the central nervous system and the peripheral nervous system. Now, we know this in athletes. We know that massage improves recovery, but what we also know is that it improves the nervous system communication so that the nervous system is communicating just a little bit faster between central and peripheral. Why is that important to an athlete? Hand-eye coordination. When their eye sees the ball coming, say they see a pitch, and they go to strike the ball, would they like that communication to happen just a little bit faster? I mean, they don't need to hit the ball early, they don't need to hit the ball late, but that communication is more efficient after massage. One of the many ways massage therapy improves the nervous system, the central and the peripheral nervous system. All right, let's move along. Let's take a breath. Let's take a breath. Whoop, whoop, whoop. All right, let's kind of shake our shoulders, flex and extend our head. Yeah, all right. Do we need to know, question in the chat, do we need to know meridian? I believe that's meridian points. Yeah, meridian points. No, it's out of the scope of practice. Yeah, we used to be tested, used to be on some Asian bodywork. So it was the massage and bodywork licensing exam because it included Oriental, or Asian, different Asian techniques. Yes, it is on the New York State exam. I'm not sure if it's on the Hawaii exam, but New York has their own special test, as does Hawaii. Yes. And so the MBLEX is a different beast. It was really designed in its initial to be an English as a second language test. But it is no longer that. It has moved way away from that. especially since the NCB TMB no longer offers a licensing exam. The National Certification Board, in fact, I'll stick that in the chat. Not sure if you guys have heard of it, NCB TMB. We'll talk about it next week. In fact, next week, we'll be talking about guidelines to a professional practice, ethics, laws. Yeah, I'll make it exciting, I promise. I promise. It's boring, but we got to go through it. And the NCB TMB is called the National Certification Board of Therapeutic Massage and Bodywork, and they offer advanced testing now. They used to offer entry-level testing. Maybe one day it'll come back. Whoop, whoop. But for right now, all we got is the NBLEX. So when you pass the NBLEX, after doing your first 100 massages, your first 100 hours, you will then be you then qualify to explore more advanced certifications, and we'll talk about that more next week. All right, very good. All right, some of you have to hop right off. That's cool. I'm going to share my screen one more time because I want to go through with you a couple of examples from the practice exam. So we're not going to dissect questions today. Well, we are, but not to get to the answer. You're going to see the answers. These are questions from the actual practice exam. Not that you'll get them, but good to know. Good to see what you're going to be seeing. All right. So here's a question. And we'll only do 2 or 3 of these. We'll end right on time today. So question is, what is the meaning of the word assessment? And already, this is an intimidating question to some, to most, even me, because it's long, right? What is assessment? Shish, what is assessment? Well, like when you talk to the client, right? Okay, so what is assessment? In your own words, that's what I want you to think about. What is assessment? If you're on this test, you're in your little cubicle, and it's like, okay, what is assessment? It's that part of the session where you're maybe doing a client assessment, right? Oh, but wait, what about SOAP notes? SOAP, right? When are SOAP notes done? Before or after the session? A lot of times after, right? So wait a minute, an assessment, is that going to be the part about the client when we're talking to them, or is that going to be the part where we're writing our SOAP notes? Let's go check out the answers. Again, we're going to eliminate 2 wrong answers. We're going to get to the best answer. All right, answer A. This is an alternative form of dispute resolution that takes place out of court. All parties in the dispute select an impartial third party, agree in advance to comply with the award, and participate in a hearing where evidence and testimonies are presented. Letter B, second choice. What is the meaning of the word assessment? Answer B, communication in which people reveal clues to unspoken intentions or feelings through physical behaviors such as posture, gestures, facial expressions, and eye movements. C, a feeling, disposition, or expression of positive or negative evaluations of people, objects, events, and activities or ideas. Letter D, a systematic method of approach to gathering information about a client's condition and symptoms. All right, tell me. Bang, 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 bang. Yes, yes, yes. In this case, this is an actual test that I've pulled the results of one of our students. This student got the question wrong. You can see the X. The correct answer is letter D. An assessment is a systematic approach, a systematic method of gathering information about a client's condition and their symptoms. So we're doing an assessment for the client. This A is mediation. This is body language. Letter B, body language. And then, well, let's move on. Let's move on to one. Okay, let's take a look at this. Decreasing edema is a reflexive effect of what type of treatment? And in this particular case, the student got the question correct, so we see the answer. But let's take a look at the question. Decreasing edema. What is edema? It's not the name of your aunt. It's not, oh man, the guy on TV. What's his name? Yeah, come to me. All right, swelling, yes, swelling. Edema is swelling. Reflexive effect. This is our last teaching moment before we close. Reflexive effect. All right, you'll have a chance to learn lots about the reflexive and mechanical effects of massage, but reflexive effect, the reflexive effect is one you'll need to know, because a reflexive effect, its partner is mechanical. So a mechanical effect of massage, common sense, right? Mechanical. What have we stretched? Have we done a pin on the myofascial layer? Have we mechanically moved? Or is this effect a reflexive effect, which is one we can't think about and control? For example, it's not in our answers, but hyperemia. Hyperemia is simply pink, blood-rich tissue. Hyperemia. Hyper, lots of blood in that, a nice pink tissue. You see that when you massage sometimes, right? Get those traps going, those trapezius going, and you see a change from white to pink. Did that client think about it? Did the client think to themselves, okay, send blood to my traps, send blood to my traps, send blood to my traps? No, right? The body is reacting. So if it is, so for example, digestion, heartbeat, these are things that we don't think about. We don't have to look at our belly and say, digest, digest, digest. So these are things controlled by the autonomic nervous system. So that's the question. Dissecting the question, decreasing edema is a reflexive effect of what type of treatment? Best answer, A, jostling or shaking, B, Swedish gymnastics, C, fine vibration, D, light and deep effleurage. We're looking for best answer here. Now, one of these four answers is completely wrong. Completely out of the ballpark. What is it? Which one? There is one that is the worst answer ever because it has nothing to do with this question. Oh, you're getting it. You're getting it. Yes. Yes. Swedish gymnastics. You didn't get fooled. Swedish gymnastics is gymnastics. I don't know if you remember Per Heinrich Kling, the father of massage. He was the inventor of Swedish gymnastics, and it led to Swedish massage and the 5 basic strokes of Swedish massage. Don't be fooled. Good job. You weren't fooled. Guys. All right. So we got rid of Swedish gymnastics. Fine vibration. What the hell even is that, right? It's like, this is vibration, right? Little vibration. Don't confuse it with compression. Vibration. So is fine vibration going to be in there? Probably not, right? We already see the answer. But you would, at that point, have a choice to choose between jostling and shaking, letter A, or light and deep effleurage. And we get to the best answer. Both will most likely reduce edema, but light and deep effleurage is the best answer because we're gliding, we're moving that edema out. All right. That's that, guys. Guys and gals, nice work. And we just looked at the lower leg. Can you believe it? I really thought I have another PowerPoint ready to go because I thought we were going to just, cruise through the lower leg. And yet there's so much rich learning, in as we go through not only the anatomy and physiology, but you get to review the movements, you get to review endangerment sites, you get to review reflexology. Great job today. Great job hanging in there. You're all here. Yay. So I'm going to go ahead and wrap up the recording. Thank you so much for your time today. My name is Jody Scholes. I am an instructor. I am your instructor for the MBLEX review course. If you have enjoyed this recording, feel free to find me, find this community at the patron site at the patreon.com/Jody Scholes. It'll be in the comments. It'll be in the, the description. Feel free to come and join us. We do a weekly class for our patron community. I do a weekly class for the patron community, but only every other week is a video posted to be public. If you like all the juice, if you want to get all the learning, that's for the patron community. So I welcome you to that and to learn more about what that means. So signing off for today with the foundational learning in the lower body. Have a great week. Have a great rest of your day.